The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, it's Gil Lederman. We're live at the WOR studios, broadcasting tonight. We're taking your calls if you have questions, so feel free to call us. The number's 800-321-0710, 800-321-0710. We want to welcome some special listeners, and from New Jersey, as a very special couple, wonderful couple, Andy and Susan are listening. And from California, we have Ariel listening. So, yeah, we're broadcast across the nation. Actually, it's a worldwide broadcast. This goes on computers, and we've had calls from all over. A couple days ago, I got a call about a cancer patient from Panama who was listening to the show, who we hope to help. So, good evening, Ariel, Andy, Susan. Hope you enjoy the show. I was sitting here wondering, imagine there's two treatments, and I need some help from the listeners, so you can call me and tell me what your thoughts are. Our number is 800-321-0710. Let's say there's a disease, and one treatment, you get your head opened up. So they put you to sleep. The surgeon opens up your head. It means they have to cut through the scalp and the skull. They get a buzzsaw like a carpenter and cut through your skull. And then they localize the tumor, and the tumor is by the delicate brainstem and cranial nerves. And the tumor is on a nerve that's for hearing and balance. So when they cut that tumor, you usually lose your hearing. 90% of the people lose their hearing, which means you don't have stereo hearing. Many people have damage to the facial nerve. About half the patients are unable to have a normal facial nerve function, which means when you smile, half your face doesn't move. When you have some soup or tea or coffee, you can't close your mouth, so it comes right out of your mouth. You can't show this usual expression. You've probably seen people walking down the street who have facial paralysis. I'm not talking about Bell's palsy, which is a temporary phenomenon. I'm talking about a permanent phenomenon. So one treatment is opening up your head, major surgery, having someone's hands in your head, usually leading to deafness, often leading to facial paralysis for the rest of your life, with about a 1% chance of death. That's one treatment. And then the other treatment, imagine the other treatment, you can come in to doctor's office, let's say you had, or at Starbucks or something if you're a high roller, or Dunkin' Donuts like me if you're a low roller. Come in, get a treatment, you lay on a table, a magical beam hits that tumor, hits it for about, let's say, 5-10 minutes. Then you get up and you go back to work. You go across the street to go shopping, Macy's, or go to Times Square or whatever, go home or go to the grocery store or go to work or to pick up the kids. So you have two treatments. One, open up the head, general anesthesia, convalescence, probably never are the same again. And the other treatment, beams hit the tumor, no cutting, no bleeding, and then the tumor starts shrinking with a success rate of about 97%. Oh, by the way, the recurrence rate after surgery is probably around 20-30%. So you're talking about high recurrence rates, high damage, and death in the surgical treatment. And then this magical moonbeam treatment, 5 treatments, each about 10 minutes. You lay on a table. And then most commonly, we get follow-up scans, and we see the tumor stopping, shrinking for the rest of your life. Which treatment would you take? And what would make your decision? So why do I ask this? Well, this week, I had a call from California, a patient, 30-year-old man. His wife called. He had an acoustic neuroma. He was seen by an ear doctor who's a surgeon and was referred to surgeons. He said, oh, you have a brain tumor. We have to cut it out immediately. And they, without even giving him almost a chance to catch his breath, the next day, he opened up his head, took out part of the tumor, left him deaf in that ear, left him with facial paralysis. He's 30 years old with a young wife and kids. And now his wife calls me up a few months later that the tumor's growing back. So he's paid all that price, he's had all that complication, and the tumor's coming back. Versus a patient I treated at the same time 6 months ago, a woman about 50 years old with an acoustic neuroma. We gave her radiosurgery. She came in my office this week. And remember, this is a tumor that usually hurts the hearing, and that's how people know about it. There's decreased hearing or decreased balance. She had our treatment, 5 treatments, each about 10 minutes, outpatient treatment, no cutting, no bleeding, no hospital. And she came in happy. Her face is fully working. She said, Doc, I can hear better. You've given me my hearing back. We got a scan. The tumor seems dead in its tracks. Think about those 2 patients. One happy, no complications, improved hearing, and the other one who will never be the same. And then you have to wonder, what the heck are surgeons doing? Yeah, it's a free country, and you should be able to choose whatever you want, and you're the president of the United States of your body. But it'd sure be nice for people to hear about all the options before one decision is made. I certainly tell people about surgery. I have nothing to hide about surgery. We're proud of our results. We were one of the first groups in the world to treat acoustic neuromas. We have the largest experience in the world treating this kind of brain tumor, and we treat other kind of brain tumors too. This is a benign tumor of the 8th nerve. It's a nerve that comes off the brain that affects hearing. But we treat meningiomas and pituitary tumors and other tumors. We treat also many cancers, probably metastasis, or cancers that spread to the brain. And the lesson is the same. You can very commonly treat the tumor without cutting, bleeding, or damage to the healthy brain. So it's certainly something to think about. The surgical option, which is a gross mechanical maneuver, versus radiosurgery, which are non-invasive beams, no screws into the head, no cutting, no bleeding, no anesthesia, no hospital stay. You come in and get a treatment and go home. And that's not the only case like that. I was sitting here thinking about what is the theme of the evening. And to me, the theme should be non-invasive treatment versus surgery. So the second issue, and we this week did a lot of cases with brachytherapy and focused beam radiation for prostate cancer, is what about prostate cancer? And that's a disease that affects 240,000 men in America. There's great data. If you look at our data, we've treated about 3,000 men over the years and follow them. We always update our data versus the chief of a big cancer hospital nearby. Now, to have surgery on the prostate means you have to open up the patient, Remember, the prostate sits between the bladder and the rectum, so you have to kind of open up the bladder, the rectum, remove the prostate. The nerves are on either side laterally, so you got everything kind of socked in there. The surgeon has to remove it, take it out cleanly without dropping any cancer cells around, and then the patient has to get sewn up and heal up. And remember, there's about a death rate also about 1% during radical prostatectomies, and complication rates and hospitalizations, versus our method, which is hitting the prostate with our beams from outside and then usually poking some seeds in to the prostate through a little needle through the skin without any incision, without any suturing. It takes about 45 minutes and the patient goes home. So there are two extremes, one a gross mechanical removal and one a targeting with computerized beams in this day and age. And you can imagine what is the difference. Well, you might not imagine the difference because actually surgery is very popular. Can you believe surgery is very popular, even though, let's say for a man with prostate cancer who's got a PSA, and the PSA is prostatic-specific antigen, between 4 and 10, which is a very common range nowadays because so many men are getting screened. We often find those cancers when they're just in their infancy. So an early prostate cancer found going to the big surgeon at a big cancer hospital, the chief there, versus coming to us, the success rate with surgery, so-called success, is 76% at 5 years. 76% of the patients are cancer-free. Now, does it make sense if the cancer's in the prostate and the surgeon removes the prostate? People are often led to believe that they're going to be home free by removing that prostate. Why is it that a quarter of the men have recurrence of their cancer within 5 years? And this isn't a low-risk group. This is just PSA 4 to 10. Versus us, hitting the prostate cancer with our beam, we have a 90% success. 18% more men are cancer-free. Well, if you multiply 18% times 240,000 men, you're talking about 45,000 more men who would be cancer-free if they came to us rather than surgery. So if you were betting your life at a casino in Atlantic City and one casino was 76% and one was 90%, where would you put your odds? Where would you take your risks? I like the 90% with Dr. Lederman. I like the ring of that name, too. Now, one other issue with radical surgery, if you talk to men, and I got the article right here, with radical surgery, whether it's traditional nerve-sparing radical or robotic, 20% of men had no problem with their urine control after surgery, but 80% did. 80% of men had trouble controlling their urine after radical surgery, whether it was robotic or open. With us, that's essentially never a problem. And sexual function, guess what percent of men who have surgery, open or robotic, have no sexual problem? That usually means erections adequate for intercourse. Well, it's only about 3% of men after surgery have no problem, which means about 97% of men have problems. So if you have a lower success rate, you have to get opened up, hospitalized, you end up with a greater recurrence rate of the cancer. Most men have sexual problems. Most men have urinary problems. Versus those beams, radiosurgery with us, where would you go? It just doesn't make sense. You wonder how surgeons stay in business. You just can't fathom it. And then, after this break, we've got some words from some new voices here. We're going to take your calls, and then I want to talk about one more issue. After I've talked about already the acoustic neuromas and brain tumors, I talked about prostate cancers. I want to talk about one more major issue, the beam versus open surgery. So again, we're at WOR. Our number is 1-800-321-0710, 1-800-321-0710. Here's some new voices, meaning not mine, to tell you about treatment options for you.
For cancer treatment, most prefer effective, non-invasive, well-tolerated